Hi everyone. For this week's flashcard presentation, I'm going to be discussing croup. So croup, also referred to as laryngotracheitis or laryngotracheobronchitis, is a viral respiratory infection common in kids 6 months to 3 years old. Inflammation of the larynx, trachea, and bronchi result in obstruction of the airway, causing the hallmark signs and symptoms, which I'll be discussing below. In about 75% of the cases, the causative organisms of this inflammation are parainfluenza viruses. Other common causative organisms include adenoviruses, influenza, RSV, and rhinovirus. The COVID-19 virus has also recently been shown to cause croup in young children. So for risk factors, croup is more common in boys than girls and usually occurs during the fall and winter months. Children with a history of being born premature or who have required prior intubation are more at risk for developing croup. Those with GERD and asthma are also more at risk. Finally, children with a family history of croup are at a higher risk for developing the illness. So for major signs and symptoms, there is typically an abrupt onset of the signs and symptoms of croup. Symptoms are usually worse at night or with emotional distress, so for an infant that could be crying or agitation. The 3 hallmark signs of croup are inspiratory stridor, hoarseness, and a barking seal-like cough. The croup cough usually lasts around 3 days, and symptoms typically begin, however, with nasal congestion and discharge, and occasionally a low-grade fever. If there is significant edema and obstruction of the airway, tachypnea, dyspnea, retractions, and nasal flaring can also occur. No diagnostic tests are required for a diagnosis of croup. Diagnosis is made via physical exam, but if a laryngoscopy were to be performed, it would show redness and swelling below the vocal cords with fibrinous exudae often present. Viral cultures and a complete blood count may also be used to differentiate from other respiratory illnesses. And here in this image you can see the effects in the location of the swelling in a child with croup compared to the larynx of a healthy child. And below are my references. Thanks for listening.